Hi, I'm Randall Sechrist, your host for eOrthopodTV, and today we're talking remotely once again with Dr. Brett Fink. Dr. Fink is an orthopedic foot and ankle surgeon who practices at Community Health Network in Indianapolis, Indiana. Dr. Fink did his medical school training at Washington University in St. Louis, and from there an orthopedic residency at the Portsmouth Naval Hospital in Portsmouth, Virginia. And from there, 2 orthopedic foot and ankle fellowships, one at Boston University and the other at University of Miami. Thanks for joining us again today, Dr. Fink.
Thank you, Randall.
Dr. Fink, today I thought we would talk a bit about bunions. And I think most people are familiar with the term bunions, which is a condition of the foot that we sometimes as orthopedic surgeons call Hallux Valgus. But if you would, start out by describing exactly what a bunion is and how a bunion forms.
You're right, a bunion is, when you see it, you know what it is. But a bunion is a very complex deformity, and most people notice a bunion because it is a prominence on the inside of the foot, a prominence right about where at the base of the toe. It forms because the joints of the big toe become unstable. One of the bones, the metatarsal bone, which is on the end of the front of the foot and ends at about the ball of the foot, starts to tilt towards the inside of the foot, out towards the border of the foot. The other toe starts to tilt towards the other toes. The big toe tilts towards the second toe so that the joint becomes very prominent. And that can become a problem when someone is trying to wear shoes because the bump on the inside of the foot hits the shoe and becomes very uncomfortable.
Well, let's talk a little bit about why patients come to see you as a foot surgeon when they have a bunion. Is this because of pain or because of the deformity? What brings folks into your office?
There are a lot of reasons that people can come in. The most common is because it hurts, because they just can't find shoes that fit properly. However, many times people come in because they're worried about what might happen in the future to them as far as the bunion's concerned. They're worried that if they don't have surgery right away that the deformity could be a bigger problem, or they're concerned that they might not be doing something right. I often get parents that come in because they're worried about their children's feet and whether they're going to develop properly or become a problem in the future.
Well, and you mentioned children coming in with bunions. What sort of groups of people do we see most likely that present with bunions? Is this something that we see in children? Is it something that we see in adults, men, women? What sort of things do you find are common to folks that end up with bunions?
Well, basically there are 2 types of bunions. There's the adolescent bunion, which is the bunion that has formed in a foot where the toe has never really been straight. This is a bunion that is primarily caused by genetics. People are just their genes have programmed their foot to develop a bunion, and many times these people will have mothers or grandmothers that also have had bunions all their life. And this is quite a different deformity than the developmental bunion or adult bunion, which usually forms over the course of a lifetime and might come in with a history of the toe beginning fairly straight in young adulthood, but as they go into middle age, the toe becomes more and more out of alignment. And that's more of a developmental problem.
And when you say developmental, I mean, is this something that occurs over years? Is it something that can occur fairly rapidly once it starts?
Well, usually it does occur over years, but sometimes it can be pretty rapid. As a matter of fact, rarely I see people that have had injuries that will develop a traumatic bunion where the ligaments around the joint become unstable as a result of trauma and actually fall out of place, and that can occur over a period of hours or even instantaneously.
Well, let's try to give the viewer some idea of how this deformity occurs. Can you describe the forces that are at work on the foot in the developmental bunion, the one that occurs in adulthood, how this progresses over time?
Well, that's a very good question and a very complicated question, and unfortunately no one knows really why bunions develop. What we do know is that bunions are much more common in societies where they wear shoes. So the shoes probably have a part in the development of the bunion. And it's unclear to me whether it is because the shoes are too tight or because they change the way that the foot develops in such a way that it doesn't develop proper strength. And that's something that I think people just haven't figured out yet. But what might happen is that the pressure from the shoes may deform the toes over time such that they twist into a funny direction. The ligaments on the outside, or the inside border of the foot, the border that's towards the other foot, may stretch out so that the toe becomes looser. There also may be a situation where the muscles do not develop properly, and because of that, the joints are allowed to stretch out over time. It's really quite unclear, and a great source of interest to myself, and something that I have thought about a great deal.
Well, I think we as orthopedic surgeons, we're always fond of telling people to buy the appropriate shoes. I think we're less likely to tell people what the appropriate shoe wear is. And there's been some discussion in the past over the years about high-heeled shoes, pointy-toed shoes, different types of shoes that may be conducive to the formation of bunion. Do you feel that there are certain types of shoe wear that are more likely to cause a bunion than others?
Well, I do believe that that high-heeled and pointy-toed shoes probably do cause some of the bunions that I see. But I've got to tell you, people often come in kind of berating themselves, putting themselves down because they've worn, quote, bad shoes, unquote, all their life. And I've got to say that I don't think it's as big a factor as many doctors suggest that it is. Certainly, if you cram your toes into a pointed-toed shoe and press it in there over time, you'd expect the toe to develop that shape. But a large number of my patients have never really worn shoes like that, and I am unsure that it is a big factor in the development of most bunions. Now, to get to your second question, which is, what are the right shoes for someone that is starting to develop a bunion? Well, I think that a shoe that has a upper, the top portion of the shoe, which is soft and compliant and conforms to the foot, is probably important. It's also important not to wear an exaggerated heel, and I think that some degree of elevation, perhaps half an inch to an inch, is probably okay. But you certainly don't want to have a 3-inch heel, more or less stuffing your toes into a very narrow and abnormal shoebox.
Well, we've talked about, I guess, the genetics of the condition. We've talked a little bit about shoe wear. Is there any other conditions that bunions are associated with, other types of medical conditions that may predispose a patient to developing a bunion?
Oh, there are a large number of them. As a matter of fact, the most common